Hi, my name is Costa from Platinum Plastic Surgery in Las Vegas, Nevada. Today, we're going to be answering your questions about plastic surgery. Can I use my own fat for a breast augmentation? The answer is yes. This is actually a fantastic procedure in the properly indicated patient. The reason why it's not done all the time is because the indications for the procedure are kind of on the narrower side. So what type of person would be indicated for fat transfer to the breast? This is typically a patient who is looking for some increase in breast volume, but not necessarily like a huge change, like a half cup to like a 1 cup change in breast size. Maybe they actually really like being a full B. They just feel like they have some hollowness in their breasts, or like they don't have much of a cleavage line, and they're not trying to be like a full C or a D, and they want to know like what kind of options are available. That's someone that may benefit from like fat transfer to the breast. The patient's anatomy is also like very, very important. The way fat survives is it has to have oxygen and nutrients, and it has to be in an environment where it's not being overly compressed so it can get that oxygen and nutrients and stuff like that. If your tissue is very, very tight, like you don't have very much breast tissue and you don't have any like loose skin or anything like that, that fat will likely not take very well to that area because it needs kind of like some looseness in that area to kind of like fill up and expand into. On that note too, fat is not like an implant. Okay, an implant has a nice shape. It's got a covering, so it keeps everything within the implant, and it keeps its structure and its shape no matter what. But fat is like jelly, like on toast. So, you know, you can squish it, you can squeeze it, it goes everywhere. So if you try to put fat in a breast that's very, very compressed, that fat doesn't have the force to like hold its shape. It's gonna kind of spread out like wherever it wants to. It's very important that you have the right anatomy of someone who can like take fat and like have a good result where most of that fat stays and it gives a good aesthetic outcome, and most importantly obviously like gives the outcome that the patient is looking for. Because if you are interested in, let's say, like being 2 to 3 cup sizes more, and you really want like a more projecting breast and that upper pole fullness increase, but fat is probably not going to get you to where you want to be. That being said, the only way you'll ever know is to go see a board certified plastic surgeon and get their opinion, see what they think, see like what their experience is with patients with your type of anatomy. If you're looking for any more information about this procedure or any of the procedures I perform, please go to drcosta.com, fill out a free virtual consultation. We can review that and let you know what we think the best plan will be to get you towards your goals. Thank you for checking out my video. Comment, like, subscribe to our page to get more of this type of content. It tells us that you like what we're doing and that you want to learn more. If there's a video or a question that you want to know, please leave it in the comments and we will absolutely do our best to get that to you.